I'm digital anchor Andre Ash. Joining us from Studio 1452 is Eric Doa. He is the president and CEO of the Detroit Wayne Integrated Health Network. Eric, thanks so much for joining us.
Well, thank you so much for having me, Andre. I really appreciate it. Thank you.
Absolutely. So as the president and CEO, you lead an organization that is tasked with the mission of providing behavioral health services and to support a very vulnerable population here in Wayne County. How important is the role of the DWIHN?
Wow, what a great question. We support well over 75,000 folks, 15,000 kids, and as we look at Wayne County as a whole with a population of roughly 1.6 million people, there is an expectation that we serve even more people, and we welcome that, so to be able to provide services, critical services, needed services when it comes to behavioral health and substance use disorder is something that we welcome, and we don't want to be that best kept secret for sure.
Yeah, absolutely. The organization's partnership, DWIHN, this partnership with the Detroit Police Department, it appears to be a game changer. How does this collaboration and training enhance how officers do their jobs and how they interact with or encounter the mentally challenged citizens in our community?
First, just thanking our law enforcement partners. They've been great. Chief White has tremendous leadership that he provided. And, when we decided to bring CIT training, which is Crisis Intervention Training Team, the idea was really 2 years ago when we saw what was happening with our, folks we provide services for when they came into contact with law enforcement. Those oftentimes were not the best results, so we wanted to figure out what could we do to bridge that gap. I mean, can you imagine folks who provide behavioral health services coming together with the law enforcement community? But it has turned out to be such a great partnership, not only from an education standpoint, being able to educate officers so that when they encounter folks with behavioral health challenges, they know how to deal in those situations. But also, this has been helpful for the law enforcement folks as well, because now we have embedded our clinicians within those dispatch centers. So when those calls come in from folks who actually need, behavioral health services, they are not flooding those police lines, where those calls can be, rerouted for emergency purposes.
Yeah. Really changing the dynamic of how law enforcement responds to certain calls, and with the help of the training here, it appears to be very crucial. But talking about behavioral health or mental wellness has seemed to be a taboo topic to discuss, particularly in the Black community.
Absolutely.
How do we begin to change that? How do we begin to change that?
Truly, that stigma has always been there, and unfortunately within the African American community has been even more pronounced. But I think when you look at it from this perspective, mental health is no different from physical health. I mean, we all go through physical health challenges, and I always tell folks there's a reason why you have an urgent care center within many of our communities, because they realize that one day, Andre, you and myself will be in that kitchen cooking something, and we're bound to cut ourselves, and we'll need someplace to go.
Yeah.
We don't necessarily need to go to, Henry Ford or Receiving. We just want to go someplace that they'll be able to stitch us up, get us going back, And sometimes that's what people with mental health challenges, you come across those moments where something tragic happens or something that just changes your balance, and you just need either someone to talk to, someone to connect with. And so having that is so critical. I mean, sometimes we talk about an uncle who we knew, who all the family knew had something going on, and all that was said was, oh, that's just Uncle James being Uncle James, not realizing that there was a mental health, challenge that Uncle James had. And so now to be able to say to folks, hey, there's nothing wrong with that. We're here to listen. We're here to help.
Yeah, and a part of changing and removing that stigma is being forward-thinking, forward-leaning. So let's talk about some of the outreach programs that WIHN DWIHN services provides to the
True.
community when it comes to outreach?
Absolutely. Look, first we start with just with our children, and I look at what COVID has done to our communities. The resiliency of our kids isn't something that I think we should take for granted. I mean, you and I don't think we can look back on our school days and think of times that we had to wear masks to school. Our
Right.
kids have had to do that for over 2 years.
Yeah.
And so we've put together a children initiatives to really be able to connect with children. And when I say children, I'm talking from birth to 18, when
Yeah.
folks think you're able to handle everything on your own.
Yeah.
So we've come up with a children's initiative where we are linking kids not only to behavioral health services, but also opportunities within our county, whether you're talking STEM programs, educational programs, job training, all of that is available. But when you talk about the core mental health services that we provide, assessments, I mean, you talk about things like that. You talk about adult services. We provide services, to pregnant moms as well. So all of those opportunities are there within Detroit Wayne.
Nice. It is universally still believed that there are not a lot of resources dedicated to treating mental wellness. Ever since the budget cuts and closure of hospitals during the Engler administration. But what is the conversation today when it comes to financial allocation to support organizations like yours?
Sure. Well, well over 95% of our budget comes directly from the state and federal government. So we're talking like Medicaid dollars here. I also want to note, too, that, the governor has put in her budget proposal to the legislature well over, if you look at it, $130 million alone to put more clinicians within the school-based setting, another $120 million to make sure that we retain clinicians within the system. But when you look at it from the perspective that these are your tax-paying dollars, so I want to be good stewards of those dollars, but I also want to make it very clear, too, that we are not going to turn anyone away who needs those services. So whether you have a substance abuse challenge, mental health challenge, please reach out to us. That 1-800-241-4949, that number, it is a reason why I have it committed to memory, not just for self, but also to be able to recognize, that we are in a community that sometimes folks don't know about the resources that we have. And I don't want to be that best kept secret. We've set up, a 1-800 Reach Us Detroit, when we realized that many of our young people, didn't have an outlet when COVID first hit. And so now that folks can text and call, they're able to do all of that with the resources that we've been able to provide.
We'll provide that number and website once again in just a moment. But, watching sports is a way for some to clear their minds, when it comes to the stresses of everyday life.
Yeah.
But for athletes, being in the game brings pressures both physically and mentally. So as we're entering the season of March Madness, for example, how important is it to maintain that emotional wellness as it relates to sports?
It is simply,
sports health.
Yeah, it is simply part of health. I had the opportunity to speak with the great Herman Moore, and H is one of those guys who is so very transparent about not only his playing days but also the challenges that he faced as well. And so now he's in a space where he's able to provide teachings to young children, young athletes, in how recognizing that, hey, there is nothing wrong with recognizing that sometimes we come upon those challenges that we need a little bit of help. Think about it. Naomi Okazaki, here's one of the great tennis players, young athlete, who've come upon some difficult times, but she's been very transparent in reaching out and saying that, hey, mental health is a health situation. It is a physical health. It is very similar to physical health challenges. So
and she's taking that time for herself to treat her mental wellness.
Absolutely. So when you have world-class athletes, when you have folks who we sometimes think are invincible, when they have those moments of stepping back and having to say, hey, you know what? I need a break. I need a mental health break. That, I think, when it's out here in the public, there's a recognition then that, wow, you know what? I'm not alone in this.
You lead an organization tasked with helping vulnerable populations. What drives or motivate the work that you're doing?
Wow, what a loaded question in so many ways. You know, when you have kids or when you have, whether they're nieces and nephews, you come to the realization that you want them to grow up in the world that is not just all about the family unit that you all have. It has to extend outside of that. And I look at young people within our communities recognizing that if I can do just a little bit to improve the quality of health of them, to improve their current condition, no matter what that is. And sometimes, you know, we have kids who are doing well, and we just say, you know what, they're already doing well. And then we focus a lot on the kids who are struggling. The opportunity that we have here at Detroit Wayne, I want it to be one where we offer it to all kids, no matter what economic condition you're coming from, no matter what parts of Wayne County you are coming from. I want every kid, every adult to know that Detroit Wayne has a resource to connect and improve the quality of health for them.
Absolutely. And how can Wayne County residents learn more about services, programs? There's that website and number you gave earlier.
I tell you, besides that, you know, 1-800-241-4949, just simply type in DWIN, you know, into Google, and trust me, we will come up and you will see all of our resources that we offer there. And, you know, I say that because I don't want us to be that Italian restaurant that is the best kept secret. I want us to be a resource to the community. And when we talk about serving 75,000 folks, it sounds great. Last year we served well over 200,000 folks. An opportunity to serve even more is something that I welcome any day.